now as we're moving into phase 3. We are not ready for phase 4. I'll just briefly remind you, phase 4 is concerts, big outdoor stadiums and sporting events, festivals, and large conventions. We're simply not there. There's no sectoral guidance that's been given. There's no authority for local health officials to move into that phase. But into phase 3, on their own pace, we are allowing local decision-making to go into effect. But it's conditioned on plans that have to be attested to by local county electeds and local health officials, and through a process of engagement with the state of California, our Department of Public Health. We put those plans on our website, covid19.ca.gov, and we actively monitor those plans. And when there are issues, we target support and engagement. Let me be specific about this and highlight just a few examples. Imperial County. We have been working with Imperial County for the last few weeks. They saw a big increase in hospitalizations. They had some cross-border issues that needed to be addressed. We brought out our DMAP teams. We brought out our National Guard. We brought in HHS officials, not just from the state of California, but in partnership with the federal government. We brought resources to bear, including field medical stations, so that we can decompress, reduce the total population in their hospital system, and get them into these temporary facilities, including the addition of more ventilators. By the way, we have roughly 11,000 ventilators within our system right now that are currently available to be targeted if there's flare-ups or needs across the state of California. So we're doing targeted engagement. We did it in Kern County recently around skilled nursing facilities. We did it in Tulare County with OSHA, and not just our health officials related to some issues in meat packing facilities. That target engagement is part of a very deliberative process of engagement based upon flare-ups, based upon hotspots, based upon areas that we are monitoring in real time with constant collaborative spirit and engagement with local officials. And that's why I just want to remind everybody, as I now transition, that if we see through the process of target engagement numbers that persist and things that get out of control, we will direct the local health officials to put a dimmer switch back on and begin to toggle back, put the brakes on in terms of the modifications and the stay-at-home orders. You saw exactly this up in Lassen County. To Lassen County's health director's credit, they saw a little bit of spike, relative numbers, relatively few, but for Lassen, a relatively large number, considering the total population. They made some targeted adjustments. They did more testing, they did tracing, and they began the process of making modifications back and forth. This is part of the process that we're in. And so the reinstitution of interventions is that third key of counter monitoring that is foundational. But again, all of this is done with local public health officer using data to decide what's appropriate for them. We are not mandating a pace for opening. San Francisco just announced, their mayor, that on June 15th, in 2 weeks, they will move forward. They're afforded the opportunity to go sooner. They, because of local conditions, chose to go a little bit later. We, again, encourage that. San Mateo wanted to move a little faster than other parts of the Bay Area, Marin than other parts of the Bay Area. Again, local public health officers using data will decide the appropriate timing for these openings. And we, again, think that is a foundational principle that you will hear over and over again that is reinforced in 3 simple words. Localism is determinative. As we put out guidelines, we are not dictating when counties move on those guidelines. That will be determined on the basis of working with local health officials, local elected officials, with attestations that require certain conditions to be met before they can move in that direction. 48 counties out of our 58 have substantially moved through the process of getting the attestations and have moved forward, but not all of them wish to do so at this time, and that's exactly what we want to see. local decision-making based on local conditions at a pace that's appropriate to meet local needs. Strong oversight, strong monitoring, targeted intervention, and capacity building, and the ability to put that dimmer switch on, the brakes on, and pull back these orders on the basis of the spread of the virus. But the bottom line, and I think it is foundational in this state, is that because of your extraordinary work, 40 million of you, we bought time. We bent this curve. In fact, we didn't bend it. We never allowed that curve to take off like other parts of this country. We've had stability for weeks and weeks and weeks. And not only did we buy time, we invested an unprecedented amount of resources, human resources and physical resources, to build capacity to meet the needs of those entering into this new phase, if indeed we see an increase in cases and an increase of hospitalization and needs for people to get the kind of support they deserve in an ICU or elsewhere. And so that's the message we're trying to communicate today, highlighted not only in this presentation, but always highlighted on that covid19.ca.gov website. Cannot encourage you more. Take a look at it. Go county by county, get a sense of what your county is doing, what your county may not be doing, and just know that that pace now is 100% going to be determined on the basis of your local health director in partnership with local county officials. We'll be putting out some new guidelines next week, substantially. Now, we're in the frame for the next few weeks of a phase 3 approach on local decision timeline.